After watching one of my recent videos on the only 2 treatment goals you need in a treatment plan, some of you had some follow-up questions, and so I wanted to answer them here. Basically, a lot of you don't believe me that it can be this easy. Hi, I'm Dr. Maelisa McCaffrey, founder of the free Private Practice Paperwork Crash Course, and in this week's video, I am going to answer the 3 most common questions I got from viewers after watching my video on the only 2 treatment goals you need for most of your client treatment plans. One of the most common questions I got was, what if the client has more than one diagnosis? So you must have meant that those 2 goals are per diagnosis, right? No. You really can have just 2 treatment goals. But this is where I have to say it depends. And I know you and I both hate it when I have to say that. Let's look at a couple scenarios to dig into this one. So first scenario, really common. You have a client who has depression and PTSD. You could actually just write a goal for the depression and a goal for the PTSD and call it good. Yes, that is good enough. And you know what? If the client has so many needs or there are so many things that you both identify you want to work on, then write 3. Totally fine. But please do not write more than 3. Try to stick with just 3 goals if you can, because realistically, you're not working on much more than that and it gets really hard to track all that stuff. What would that look like? Well, based on the video, which we will definitely link to here so you can check it out if you haven't seen it, but you could have 1 goal focused on reducing depressive symptoms, 1 goal focused on reducing PTSD symptoms, and then you could have a 3rd goal with some type of coping skill. A skill that would probably relate to many clients in this scenario is some type of social support or social skills goal. Now, where this can differ is maybe your client has more than 1 mental health diagnosis, but you are actually only working on one of those diagnoses with them. So they may see a totally different practitioner to deal with the other part of it, and in that case, what you would do is your treatment plan would have a collaboration section instead. So you would still mention that yes, this client has this diagnosis, yes, they are working on it, but they're working on it with someone else. It's not part of our goals, it's not what we'll be doing in therapy together. So in short, pick 1 goal per diagnosis that you are actually working on with your client, and then go from there. If both of you identify you really need another goal because it doesn't capture what it is you want to work on together, add another goal. You have my blessing. Just try to keep it to 3 or less. The second most common question I got after people were watching the treatment goal video was, does this actually work for insurance? Yes, of course this works for insurance. Clear, concise goals that focus specifically on the diagnosis and client behaviors, that's what insurance is dreaming of when they come to audit your treatment plans. In fact, your goals are actually a really integral part of medical necessity, which is what insurance is looking for when they look at your records. So this is a really easy way to make sure you are meeting that component for medical necessity. And we'll link a card to a video I have on medical necessity, so if you want to dive into that topic more, you can do that too. Bonus tip, write those goals in SMART format like I talked about in last week's video, and you will be a documentation superstar to any insurance auditor. I know, I'm giving you too many other videos to watch, but it's more fun that way, right? Lastly, the 3rd question I got after people watched the treatment goals video was, are you sure we don't need objectives? Okay, if you've watched any of these treatment planning videos so far, you have heard me talk about this in almost every video. No, you don't need objectives if you already have treatment goals. I mean, unless you work for an agency or a company that's telling you to write things that way, then of course do whatever your boss tells you to do. But if you have a private practice and you're making your own decisions, then no. Sometimes I think it's just the wording that throws people off. We all use different terms to mean different things when it comes to documentation, and that's part of what makes documentation confusing in general, is that there are no clear standards. But ultimately, the whole point of a treatment plan is to identify what your client wants to accomplish in therapy and how you are going to help them do that. And yes, I will link another video for you that talks about exactly what needs to go in a treatment plan. So use whatever terminology you like and feel most comfortable with, but know that you actually have a lot of flexibility when it comes to your documentation. I know, that also causes a lot of anxiety around documentation, and we have a future video coming on that. In summary, what am I doing, like a formal presentation here? This is YouTube. Okay, well, that was actually the easiest way to wrap this up. So, in summary, yes, your documentation really can be that easy. Write those 2 treatment goals, one focused on symptom reduction and one focused on increasing coping skills. And don't overcomplicate it beyond that, unless you have some rare circumstances that require it. Now do me a favor and make sure you're subscribed to my channel, because if you are still watching this video, then you're a documentation superstar and you won't want to miss what's coming up. Happy writing!